I'm excited to welcome to the program Rural Doc Alan Lindemann. Doc, what's going on, man? How are you?
We're doing really well here, Neil. And you?
Fantastic. And we're ready to get started with today's topic. Are many people allergic to bee stings?
Well, I think there are quite a few people. The problem, Neil, is that many people have a small allergy, and there are some people who have a really big allergy, which can be life-threatening. But you should go in to the emergency room, even if you have a small allergy, because you never know when you're going to change from a little one to a big one.
All right. Next question. Should I go to the emergency room if I have a welt from a bee sting?
Yes, I think that's really the best thing to do. And, sometimes these things aren't very big. They're, 1 centimeter, like half an inch, or maybe 1 whole inch of a red welt. But you just never know for sure. And you should be watched in the emergency room for a couple hours because you don't know.
Okay. What is the treatment for an allergic reaction to a bee sting?
Well, it depends on how much of an allergy you have. If you come in with a welt, say half an inch or an inch, probably all the more you're going to need is a little bit of IM Benadryl, a steroid of some kind, and IM, of course, means in the muscle.
Okay, great. What if I have been given an EpiPen for my bee allergy?
Well, I would say keep it with you always. Years ago, I had 2 patients who happened to be stung about the same time. He had his EpiPen in his house, and he died with his needle in his leg. She had her EpiPen with her, and she gave herself the injection right away. She got to the hospital. She had a little tough time, but she lived. So, if you have a bee sting allergy and if you have an EpiPen, take it with you.
How severe allergic bee sting is treated?
Well, I would say the best thing to do, it might take a little while to get an IV going. So again, Benadryl IM, a steroid IM, but you're going to need an IV. And then I would say redose the Benadryl, redose the steroid, and by all means, watch. You don't know what that person is going to do for several hours, so you have to be careful. You can't just send them home and hope they do all right.
Okay. Can bee sting allergies result in an anaphylactic shock?
Well, they certainly can, and that certainly we were talking about the man who died with the EpiPen in his leg and the lady who survived. And the man who died from anaphylactic shock, and that means that his vascular system collapses and his heart doesn't work, blood pressure goes through the floor. So that's shock, and that is anaphylactic shock.
All right, the best place to go is ruraldocalan.com and pick up Pregnancy Your Way, available today at Amazon. Thanks, Doc.
Thank you, Neil.
All right, that was the Rural Doc Alan podcast, guys. Take care.